Welcome. This is Dr. William Morrison, and I want to welcome you to the podcast today. And as always, it's always about positive vibes here, about being who you are, accepting who you are, and exploring how you can make your life more positive each and every day. I just want to talk about our first podcast today. This is my first podcast on the channel. We have several videos on the channel. However, this is the podcast section, and it's going to be about how chronic psychological stress affects the immune system. Once again, I'm Dr. William R. Morrison, MD, PhD, PsyD. I am an internal medicine specialist. I also specialize in psychoneuroimmunology, the mind body connection, and I also have a degree in clinical psychology, and I have a PhD in nutritional biochemistry and nutritional sciences. And I always like to start off with the disclaimer that the purpose of this podcast is not to diagnose or treat any disease. And of course, it's not any form of therapy in any way, shape, or form. This is for educational purposes, life coaching purposes, and just being positive and talk about positive vibes. So, again, today's episode is about how chronic psychological stress affects the immune system. And this is a very important topic dear to my heart because I often see how stress affects people on a daily basis and how stress can make any medical condition worse. Any medical condition can become worse with psychological stress. And the mind body dynamic is real. It is real and is very serious. So I like to talk about how the immune system operates. Just imagine your immune system. Imagine it as a neighborhood watch. A neighborhood watch tries to make sure that crime isn't taking place in the neighborhood, just to make sure people are keeping their grass cut, stuff like that. And the immune system is coordinated in a fashion that it's organized. It's a very organized system. And just as though we have police protecting us and how we have police making sure that the environment is safe, well, your immune system is your police force. Just look at your immune system as your police force. And it's very important to realize that the immune system is fast. It works. It's very, very fast when it has to act on any type of pathogen or any type of illness. Now imagine the sirens are blaring all day, every day. That's what chronic psychological stress can do. It sets the alarm on stuck, and it keeps the immune system at a high alert. So today, what we're going to do is we're going to unpack how long-term stress can actually reshape our immune system, how from inflammation and infection risks to it can also affect how our body responds to healing. And when the stress level is up, the immune system is on high. The alarm is on high. So, like I said, the immune system and chronic psychological stress, they work together. So, chronic psychological stress. When I talk about chronic psychological stress, I'm referring to the stressors they're persistent, they're recurring over weeks to months. This is something that happens where we have something going on in our life, and this situation is stressing us out. We go to bed stressed about it. We wake up stressed about it. And certain examples of this could be caregiver strain, financial pressure, just being isolated. If we're in a situation where we're isolated from people, we don't have many friends, that's a form, believe it or not, of psychological stress. It's not that someone has to be on your back stressing you out. Just the fact that you are isolated can increased your level of stress. If you're in a workplace, if you're being overloaded, and if you're being overworked, you may not have someone necessarily being cruel to you, but the actual workload is a form of stress. And that type of stress can affect the immune system. And it's the duration and lack of recovery time that matters. So, if you're under stress and there's no recovery time, you don't have a break, and it's continuous, it's enduring, that type of situation has even more of an effect on us. So it is the perception. Perception is what matters. Your brain's interpretation of the situation, controllability, predictability, social support, all these things can dial the stress response down or up. So we have to look at, well, are we getting the support we need from our friends? Are we talking to people? Or are we getting support from our family? That can help mitigate the stress by being open-minded, going to people, telling people that, hey, I need a little bit of help right now. Try not to keep it inside. A lot of times, because we're adults, we feel we have to be strong. We can't show vulnerability. It is perfectly okay to ask for help. Always remember that. And the cumulative wear and tear on the body from repeated activation of the stress response without adequate recovery is what makes things even more severe. So I want to delve into the actual machinery of how stress works. So the stress machinery is very important. And understanding how this works is, it really opened up my eyes, because I really didn't realize how much stress can affect people until I actually started practicing medicine, and I realized how chronic psychological stress affects people. So there's something called SAM, S-A-M, and it's called the SAM system. It's the sympathetic adrenal medullary system. And look at this as it's like a fast lane. The sympathetic nervous system, what it does is it signals the adrenal medulla to release adrenaline and noradrenaline. So what happens is the heart rate will rise, airways open, glucose or blood sugar mobilizes, and is used during a true emergency. Okay, you're being chased. I know I'm being a little dramatic here, but you're being chased by a tiger. Okay, you're being chased by a tiger. Well, SAM is going to get activated. And as I said, what is SAM? SAM is the sympathetic adrenal medullary system. So when that's activated, it's serving a purpose. It's helping you get away from the tiger. But as far as I know, most people don't have a tiger in their neighborhood. The tiger is the stress of the job, a family member getting on your last nerve, or something going on with your job. And like I always said, when you're dialed up to 100%, because I talked about it in one of my videos, when you turned up to 100%, when your dial is turned all the way up to 100%, or as we say down south, we say turned up. So if you're turned up to 100%, on a daily basis, that wears your body out. So the second thing is the HPA axis. What that is, it is the hypothalamus pituitary adrenal cortex. And what happens is the hypothalamus releases CRH. Okay, I'm going to get a little geeky here, but I have to do it. I got to get this point across. So the hypothalamus releases a hormone. It's called CRH. What this does is it promotes the pituitary to release ACTH. What happens is this causes our adrenal glands to release cortisol. Okay, I had to do that. Sorry, but it's important. Cortisol is the body's master of energy allocation. What happens is this hormone, it helps to regulate metabolism. I'm talking about cortisol, inflammation, and our circadian rhythms. That's how we sleep, we wake up, and all that kind of business. Well, in short-term stress, the orchestration is adaptive, meaning that it mobilizes resources and then turns them off. But with chronic stress, these symptoms, everything just gets jacked up. With chronic stress, what happens is these systems, they become dysregulated, they become all out of line, cortisol goes crazy, cortisol rhythms start to flatten out, receptors become less responsive, and the sympathetic fast lane dominates. So you're always in the fast lane. You're on the highway, you're in the fast lane, you're always stressed out. And once this system gets going, it tends to stay up for a while. So something that's normally helpful, such as getting out of the way of a tiger. Well, there's no tiger around. It's the stress. So this system normally is protective. So you go from helpful to harmful. So what happens is that the alarm is on and it doesn't stop. The body is designed for sprints, okay? It's designed for sprints. It's not designed for marathons. The mind, I'm talking about the mind. So the body-mind reaction, the body-mind connection, these types of stress events, look at them as sprints. But when the stress turns into a marathon, you're starting to have problems. And we're about to get into that in a minute. Persistent activation, what can it lead to? Okay, what happens is you have flattening of cortisol rhythm. So instead of a heavily peak in the morning and a gradual decline of cortisol throughout the day, what happens is you may see a lower morning peak of the cortisol and a higher evening level linked in. So what happens is research has found that fatigue and inflammation changes start to take place. Okay, we're going to get a little geeky again. Glucocorticoid resistance. What is that? Well, the immune cells can become less responsive to cortisol and anti-inflammatory signals. So what happens is, paradoxically, you end up with more inflammation exactly when the body is trying to put the brakes on, okay? So the sympathetic dominance. Well, what happens is a chronically on switch of the sympathetic nervous system. The sympathetic nervous system is when you're turned up, okay? That's when you're ready for flight or flight, okay? Fight or flight. That's what happens. When the sympathetic nervous system is turned up, you're ready for attack. You're ready for battle. But you're not trying to go for battle when you're trying to go to sleep at night. So sympathetic dominance, the sympathetic nervous system is chronically on. So you have a sympathetic system that is in a situation where you are highly responsive. So what happens is the immune system now is tilted towards inflammation, an inflammatory pathway. So when that happens, heart rate goes up. You may start to have increased arthralgias or pains in joints. I mean, it just goes on and on. And then the second immune system primer, well, your immune system, what happens is there are two major arms of the immune system. You have something called the innate immunity. That's the first responders, the barrier defenses, the white blood cells. We call them certain white blood cells. We call them macrophages. We call them neutrophils. We call them natural killer cells. Natural killer cells are cells that recognize when certain body cells, certain types of cells that may be going astray, such as trying to become cancerous. Well, natural killer cells will recognize that and take those cells out. So again, the immune system is very important, even in recognizing certain types of cancers. And what happens is we have another arm of the immune system. I just mentioned the innate immunity. We also have the adaptive immunity. So what happens is you have a specialized team of white blood cells. We call them T cells and B cells, okay? And what these cells have the ability to do is learn and have memory. And these particular white blood cells, they're slower to mobilize. However, they are targeted. They're very targeted in specific targets and certain types of organisms or infections. I'm going into the immune system like this because in my research in psychoneuroimmunology, the mind-body connection, the immune system plays a major role. So a healthy immune system is balanced. You have surveillance. It's looking for problems. I like to go to the police. Thank goodness for the police. They keep us all safe. Well, immune system is the police of your system. So what happens is a healthy immune system, you have surveillance. It's always looking for trouble. It's looking for spotting, but it's controlled. It's, remember the word controlled. So what happens is when your body is experiencing an attack, once the threat is over, the immune system is dialed down. So when it's dialed down, all is good. But chronic stress leads to the immune system chronically being elevated. So that's a problem. That's a big problem. So what does chronic stress do to us? Chronic psychological stress. Well, actually, what happens is increased sympathetic inflammation. So chronic stress, it is associated with higher levels of inflammatory markers. So these markers have names. They're interleukin 6, you have CRP. So sometimes you may hear someone went to the doctor and the doctor got a CRP level on somebody. Well, CRP is a measure of inflammation. Well, chronic stress can increase sympathetic inflammation, can actually increase levels of these stress hormones. So these stress hormones are markers. They're markers. So these markers are an indication that someone is experiencing increased stress. Also, chronic psychological stress can cause weaker antiviral defenses. So stress can actually reduce the effectiveness of our natural killer cells. That's a bad thing because it also can alter one of our main chemicals our body uses to fight infection, and it's called our interferon response. So I'm really getting into this on a scientific level because I feel that all of y'all out there really want to know about how the body works. You want to know how the body works. You want to know exactly how the immune system is involved so you can go and do research on your own. And that's what learning is about. Learning is about hearing something and saying, you know what, I'm going to look up what he said on my own. He mentioned natural killer cells. He mentioned interferon, how that works at fighting infections in our body. So what I'm going to do is I'm going to do a little bit of my own research. And that's beautiful. I highly encourage that. So chronic psychological stress can reduce natural killer cell activity and alter our interferon response. So this is crucial in fighting viruses because our body uses interferon to fight viruses. So people under high stress, people under chronic sustained stress, they can actually sometimes show slower clearance of viral infections. Can you believe that? And frequent reactivation of viruses and so forth. So they can actually get flare-ups. They say, when I just got over this, I was sick last week. How am I sick again? Psychological stress can do that to people. It really can. So it can cause people to get relapses. And they can also get an altered antibody response. So when people are under chronic psychological stress, it can actually affect how their body responds to vaccines. The vaccines may not even work as well. Under chronic psychological stress, antibody production from vaccines it may not work. The vaccines may not be even as effective because your body has an altered response. So, of course, vaccines, they help protect us. Well, if you're under chronic psychological stress, sometimes people get a poor response to their vaccines. They can even have slower wound healing. People under chronic psychological stress can have slower wound healing. Now, let's talk about that a little bit. So, tissue repair requires a very careful choreographed inflammatory on switch and a timely off switch. Chronic psychological stress can interfere with the steps of wound healing. You can also get a shift in the immune cell traffic. So chronic psychological stress can cause the stress hormones to actually work abnormally. So stress hormones influence where the immune cells go and which genes they express. So when you're under chronic stress, your body will switch towards a pro-inflammatory response. So you'll go to a pro-inflammatory switch or pathway when you're under chronic psychological stress. So you really don't want a state of chronic inflammation. And you also have autoinflammation. And what I mean by that is your body can actually start attacking itself. So chronic psychological stress can interfere how the immune system functions and can cause disruption in how the immune system recognizes what's us, which is good, and what's bad, which are organisms that are trying to attack us. So look at it this way. Chronic stress can actually push the immune system into a state of constant background noise, okay? So what happens is the signal to noise ratio drops, and what happens is that can actually mean overreacting to minor issues. So your body may overreact to just average kinds of inflammatory issues. Like, you may bump your knee and your body says, okay, well, you bumped your knee and we're going to send some chemicals to help calm that down. But if your immune system is acting abnormally, you may get an overreaction and actually have increased risk of an autoimmune disease. So that's something for you all to look at. I mean, look up what an autoimmune disease is. I mean, that's what this is about. It's about learning. It's about this podcast and my channel. It's about learning. It's interactive. We're going to have a wonderful time. And it's just going to be something where it's highly interactive. So also what happens is chronic psychological stress can actually affect how we sleep. Now, our sleep can become fragmented from chronic psychological stress, and chronic stress can also make it hard to go to sleep. Imagine you're stressed out and you're trying to lay in the bed. You're in the bed trying to sleep, but the whole time you're in the bed, you're staring up at the ceiling. And you know what? I don't know if you remember this. You used to have this saying where, try to count sheep or try to count to 10. Look, that ain't working if you're under a lot of psychological stress. If you're under chronic psychological stress, it is very, very hard to go to sleep. So that is kind of what happens. And also, we may notice that movement and muscle activity, regular activity such as physical activity which can support the immune system. So I'm going to talk about what things we can do to mitigate this. So if you're exercising, that helps the psychological stress. Regular physical activity, believe it or not, it actually supports the immune system. And also, it helps to reduce inflammatory byproducts. So it's very important to exercise. So when we're sedentary, what happens is that can actually, that's a form of stress, believe it or not. Not being active, just going to work, sitting around all day, not exercising, and then coming home, sitting around all day, watching TV, that is actually a form of stress. Your body views that as a form of stress. Also is very important to understand that if we are under a lot of psychological stress, what do we tend to do? We tend to eat. We tend to overeat. We tend to binge eat if we're under a lot of psychological stress. So we have to always remember to eat healthy. Look at what you're eating. If you have to get a food diary to kind of see what you're taking in, it helps. It really does help. It really helps that when you write down what you're eating, you kind of say to yourself, wow, I can't believe that I ate that entire pizza. Because you can't lie to yourself. You're placing it in your diary. So when you review your diary, you see what you've been eating, and that kind of helps. That helps a lot. So we have to also look at loneliness. So social connection. So loneliness is also a form of stress. Loneliness is a potent psychological stressor. Okay, and when you're chronically alone and not interacting with people, you may not be in a relationship with someone, but you may have friends. You may have someone in your family you can talk to. It's very important to do that. It's very important that we avoid self-isolation. It's very important that we do that. Stress can also affect our intestines, our gut, brain, immune system axis. What in the world is that? So If you've seen any of my videos on my channel, you know a lot of times I like to say, what's up with that? That's one of my sayings I like to say. What's up with that? So what's up with that is gut-brain immune axis. So what happens is stress can alter gut motility, meaning that it can alter how food passes through our intestines, chronic stress. Have you ever been under really chronic stress situations and you get a stomach cramp? You start getting cramps and you start getting all irregular and everything. Well, what's happening is the gut-brain immune axis is affected. Stress can alter gut motility, meaning the movement of your intestines. And the barrier function and microbiome, those are the bacteria that normally live within our intestines and their composition. So what happens is, in turn, the microbiome, the bacteria that live in us, what that does is it actually modulates our immune system. So the bacteria that live inside our intestines actually help to modulate and regulate our immune system. I'm talking about the good bacteria. I'm not talking about infections. I'm talking about the good bacteria. So chronic stress actually hits the immune system directly through our hormones and nerves, and actually indirectly through our sleep habits and even our intestines. So, I mean, stress is real. It is very real. So, we always have to take a step back and we have to look at, well, how can I improve the stress level in my life? What can I do? Is it my job? Can I get a lighter workload? If someone in my life is stressing me, we need to talk about it. I need to let them know that you're not healthy for me, and we need to figure out what we're going to do about it. How can we communicate with each other without making ourselves stressed out? How can we move forward without harming ourselves mentally? Because mental stress affects, when I say it affects everything, it really does affect everything. So we always have to keep that that communication pathway open. We always have to make sure that we do that. So we also have to look at exactly how we are affected on a daily basis by stress. So that is basically the introduction video today that I would like to talk about. And I really hope that you enjoyed this podcast. And we will be talking more in the future. Thank you so much.